was so low, 10%, but can run the treatment at that intensity, what would you do? Increase it to the minimum or prep the patient differently? So this is talking, I assume, about the motor threshold or perhaps putting the technology into a certain energy level. And sometimes as you increase the energy, and you'll probably learn about this in the next lectures ahead, we can customize this treatment for every specific type of patient. Think of it like lifting weights. Perhaps one person lifts 10 pounds, maybe another person lifts 20 pounds, another person lifts 40 pounds, but every person has their own tolerance. So the ExoMind allows us to calibrate the technology and the energy output to each patient's brain, customized to them. So in a low 10%, what are some words of wisdom that we may have? Because we have patients that sometimes have very low thresholds. We have patients that have 95%. How have you navigated this?
So it's interesting. I've got 1 year of experience, but you have a wealth of experience. So I'd love to hear also from Professor Cheng. I've had a small cohort of patients that had a very low threshold, 25, 30%. And then at the end of the spectrum, I've just also had 90%. And there's no consistent reason why, whether it's age, hydration, how strong they are as a, in terms of their personality. So I'd love to know what experience you've got in terms of the strengths of the motor cortex, Professor?
Actually, for the motor threshold things, it is the measurement, a proxy measurement for our brain sensitivities. Actually, everyone have different motor threshold, and also we have different motor threshold across different times. For example, if you in the morning drink more coffee, or last night you slept not good, that also affects the motor threshold. So it will change also. If you really follow the whole procedure and find that it is the motor threshold for 10%, that's fine. Then just use this for the subsequent treatment. But I would advise, if there's a so-called abnormal low motor threshold, you better try to do it again or assess again. For example, 3 days later, or 2 twice per week, or every week to check the motor threshold, instead of use the motor threshold for the whole subsequent 6 sessions if appears such kind of situation.
So, question for myself, actually, Professor. Do you check your motor threshold at every session? Because I currently do.
If the usual patient, I think no need to be checked every session.
Okay.
Sometimes maybe try 2 weeks, every 2 weeks. Some people will just finish the whole course with the same motor threshold. Okay. And really depends on the patient's conditions, whether there's significant changes of their lifestyle or recent any medication changes that lead you to consider to find the motor threshold again. Yeah.
Have you ever, sorry, I'm taking over the
No, you're great.
Have you ever been in a situation where you couldn't find the motor threshold? Because I've had one situation in the 12 months. What would you do in that instance? Actually,
we usually can find the motor threshold after many trials sometimes, of course.
It's me. Okay.
Yeah, yeah. And I would strongly advise you to really try best to find the motor threshold before you conduct the treatment. Sometimes maybe the patient's too nervous and make the whole procedure have some difficulties. Maybe we first relax the patients and then we try again. Then, because without the concrete motor threshold and perform the treatment, it may cause some problems. Maybe it is under performance or over the dosage that I'm not really suggest to do blindly for such kind of situation. And usually after the resting, for example, for an hour after another day, usually we can find the motor threshold finally.